feeling like a shark in a shrimp tank. Big fish, small pond in the shrimp tank.
Hi, this is Leonard Kirshen with the Orange County Shrimp Tank Podcast post-show wrap-up here in beautiful Southern California here. Our guest today is Dr. Brown.
And our office manager, Nila.
Yeah, and they came all the way from Los Alamitos to be guests on our shows, and they've been fantastic. I want to share with you, check out the orangecounty.shrimptankpodcast.com and get the full segment here. A lot of meat on the bone there. I think you're going to find it very enjoyable. I'd like to start it off with a question, something that has always been difficult for me for whatever reason. And when people ask, so what do you do? A lot of us out there, we know it. We come up with different answers, and then we go, oh, I didn't say that right. So, doctor, when somebody asks you, so what do you do? What do you say to them?
I tell them I'm a general surgeon.
You tell them you're a general surgeon. Okay.
And then they say, you're just a general surgeon. And then I say, well, as a general surgeon, I do surgery mostly on gallbladders, hernias, colon cancer, breast cancer. And then they realize, oh, it's not just, it's all that.
No, absolutely. Wow, that's very good.
So that's a great recap, Doctor. So what would you say is the key element in running a successful practice?
Being a good people person.
Yeah, there you go.
A good people person. So that helps. It's amazing that last week we had another doctor, and he talked about 95% of his business is based on referrals.
Almost all of my business is referrals from other physicians, referrals from former patients, really important, and referrals from people looking up your name online.
That without a question is absolutely fantastic. So for those listeners here and watching us right now, when most of your business is referrals, you're doing something right.
Absolutely.
So, let me ask you this too. I have a question. Experience. I've been in my business over 34 years, and it took me about 10 years to really say I mastered it, where I could feel really comfortable in the high 90s. I had the answer when there was a question. But to this day, I still check and recheck just to make sure. But in your case, doctor, how many years in the business, and when did you feel like you mastered your industry?
I've been in the business almost 31 years. It'd be 31 years on July 1st of this year. I would say it took me about 3 years. And that's because the most important part of it is connecting with the patient.
Excellent. And before we go to the next question, I just want to share with you out there, for those of you listening out there, is that I, again, delayed, and it was very painful. And Dr. Brown is awesome, and she actually tolerates you, too, like she did with me. So I just wanted to, as a disclaimer, throw that out there.
That's part of the job.
That's part of it, tolerating Leonard. Okay.
Well, I think Nila, too, has maybe a comment on that personal people kind of skills that it's so important to having that in the office,
Well, the fact is that once you walk into a doctor's office, and the first person you meet is the secretary, and if she doesn't have that good vibe, then you don't want to work with that doctor. But Dr. Brown has the most passive personality ever.
Yes.
She makes people feel comfortable. You walk in there, and she eases your mind on how she explains the procedure and how you're going to recuperate. So I think that has a lot to do for you to have that bond with your physician. Otherwise, then you're not going to have a good journey.
Yeah,
that's so important.
Yeah, and when I walked into that office there, Nila, when I saw you, I said, okay, there's the Sergeant Major. And it was okay. You had a smile there. You were very organized. You ran the show. No, you want to see competent someone running the show. There's no question. And fortunately for me, there was a smile and nothing being thrown my way. But absolutely, it was, I feel really comfortable with there. And then when the doctor came around and then, and introduced, I felt very comfortable.
And obviously I did, because I referred you.
That's right.
How about that?
That's right. You didn't wait. Okay.
So, Dr. Brown, at the end of the day, how do you want your patients to remember you and your office?
I want them to remember that I made them feel better.
Awesome.
So, you can hear it over and over, that subliminal, that communicating with your patients is vital to you.
Yes.
Very good.
The personal connection is absolutely critical.
Absolutely. And, again, the doctor and I, we talked prior, and I want to share with you out there that are watching and listening. I mean, the doctor, I'm gonna go into about social media. And in social media, we had that box that was a telephone pole or a box with a phone in it, and we made calls from it, and then we got cellular phones, and then
we moved on to things like Facebook and LinkedIn, and Instagram.
The pagers came before that, but
hey.
yeah, and then we had
we like to forget about the pagers.
Oh, I know. And then the website, and now we have the podcast. And the reason what I intro here was with the doctor is that Dr. Brown is very good at what she does. Her whole staff and her location is not far to go to, and I'm trying to share with the doctor to, to engage in some of these different options in social media for not just for the doctors, again, for a lot of you out there that are watching and listening to this. So, doctor, I know you like the cellular phone. Do you like any other social media besides that?
I haven't looked at anything other than Facebook up till now. I have received invitations from LinkedIn. However, I haven't pursued any of it, but this is the time to consider it.
And all I'm going to say, finally. But anyhow.
Well, I was trained in the day when doctors didn't advertise. It was considered unethical. Of course, times have changed,
They
so
changed.
it's time to reconsider.
I gotta give it to you too, because she wasn't even trying to consider. She would just say, "Oh no, 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 no."
There we go. There
We
we
got
go.
great intel there, folks. All right. The bonuses went out the window.
So to reiterate, what is the best way to contact the office today?
The best way to contact me is by telephone at 562-430-2103. We're located in Los Alamitos, just across the street from the Los Alamitos racetrack. For those who use the internet, we can be found by simply Googling my name. There is a rating system called Health Grades where my name does show up.
And guess where else you can contact the doctor? orangecounty.shrimptankpodcast.com.
Thank you.
Oh, there's another one right there. Hey, again, I want to thank Dr. Brown.
And our office manager, Nila.
Hey, and this was a great, fun time, guys. And you got to check out the Orange County Shrimp Tank podcast show. There's a lot of laughs, a lot of information, and a lot of helpful information. And even just download the podcast. Again, check out iTunes, YouTube, Google Play. And just, and again, if you want to be on the show, check it out at the same time. We'll see what we can do for you. And again, with the ups and downs with the business world, and there are quite a bit of that, always stay cool.
I've been feeling like a shark in a shrimp tank. Big fish, small pond, and